Perfect. Welcome in, everyone. Welcome to the Heart Disease Prevention webinar. Today is our third installment of the series, and we're really excited to be bringing you Dr. Ozner and Dr. Tan once again for a whole hour answering your questions. So keep in mind that tonight does not replace any diagnosis or it's not a replacement for a treatment. So if you have questions for your doctors, feel free to reach out to them in regards to your conditions or reach out to Dr. Tan. I'm sure they'll be able to help you and guide you with that. So tonight, we're basically going to be answering questions that we've gathered through the weeks that, thanks to all of you, we've been thinking about and tinkering with and sharing it and seeing which questions are the ones that are the most important to address tonight. And I'm going to share them with you shortly. It's exactly 8 o'clock, and I know some folks are going to be joining us anytime. Let's give them a few more minutes to join us. And in the meantime, we'll just hang out for a little bit. Oh, yes, if you have any questions tonight, feel free to send them through the chat and we'll make sure to address them towards the end of the hour. So let me go ahead and share the questions that we already have in mind for tonight. And just give me a few more minutes here. This is live, y'all. Okay, here we go. Hope everyone can see them. And the reason why we're sharing them is because we want you to ask us questions that are a little bit different than these. And so you can think about different questions as Dr. Ozner takes us through the beginning of the hour shortly. Okay. I see new faces coming through. Thank you so much. Welcome to the Heart Disease Prevention webinar once again. We're very excited to have you tonight. In a few minutes, we're going to be starting, and Dr. Ozner and Dr. Tan are going to be taking us through these questions that you are seeing on your screen right now. Towards the end of the hour, we're going to be hopefully addressing the questions that come through the chat. So make sure that you submit those as our goes through, and we'll address them towards the last maybe 20 minutes. Okay, let me see. Any more new faces joining us? All right. Thank you so much once again for being here tonight. I think this is a good time for Dr. Ozner to kick it off. Oh, let me unmute here. Can you unmute yourself, Dr. Ozner?
Okay.
There you go.
So thanks again for organizing everything, Allison, and Dr. Tan and I are delighted to be here. And so I guess I'm going to kick it off with the questions that Dr. Tan gave me. And, you know, certainly these questions came from the last two webinars that we've had. So let's start with the first question. What is cholesterol? When we talk about cholesterol, but what actually is cholesterol? Well, cholesterol is actually a waxy type of fat that we have, and it is present in all animals, not plants, but animals. And, you know, so cholesterol has been vilified that it's really it's a bad thing because they can get into the arteries and create plaques and heart attacks. But cholesterol is essential for our body. And because it's essential, every cell in our body is capable of producing cholesterol for its physiological needs. And so what does cholesterol actually do? Well, first of all, it's very important for the membrane, structural support of the membrane of all this billions and billions of cells in our body. So for that structural support, we need cholesterol. And in addition to that, we also need it for a number of different things that are really important, such as vitamin D. We need cholesterol for our body to help produce vitamin D. We certainly need cholesterol for bile acids. Bile acids are important to help us digest food. It actually is needed for production of stress hormones like cortisol. And, the other thing that people are not aware of is that it's also important for hormones such as estrogen and testosterone. And so it does a number of things, and it's important. The problem, of course, is when we get too much of a good thing, too much cholesterol. And that was my, the first lecture that I gave. I showed everybody the video and how cholesterol, since it is one of those substances that can't travel in the bloodstream by itself, it has to be carried by these round spherical structures called lipoproteins. And if there are too many lipoproteins, what happens is that those lipoproteins end up getting into the arterial blood vessel wall and create what we term an atherosclerotic plaque, which is like a pimple in the artery wall. And when the plaque gets inflamed and it certainly can increase in size, it can actually rupture. And when it ruptures, we have a heart attack if it occurs in an artery in the heart. If it's an artery in the brain, we have a stroke. We have peripheral vascular catastrophes. But overall, that's the situation with cholesterol. Something that is very useful, very critical for our survival, but in excess amounts, it could be very detrimental. So how do we determine that? Well, we determine that by measuring cholesterol levels, and that gets into question number 2. And that is actually a very good question. Why are there different standards of normal cholesterol levels, such as total cholesterol? Should it be 200? And that's 200 milligrams per deciliter, or 150. And the LDL, which is also called the bad cholesterol, should it be less than 100? Should it be less than 80? And there's a lot of confusion in that because, certainly the levels change based on science, based on clinical research studies. So I could tell you that when I first went into practice, a normal cholesterol level was considered any cholesterol level up to 300. Think about that, up to 300. Now, we know that lower is better, and I'll discuss that concept because you're going to hear that several times tonight. The lower we could get cholesterol, specifically the bad types of cholesterol, which I talked about in my first lecture, but to reiterate, we're talking about LDL cholesterol, we're talking about lipoprotein A, and a number of these other types of cholesterol that can get into the arterial wall and create these plaques that can lead to heart attacks. So what we now know is that a cholesterol level ideally should be less, total cholesterol should be less than 150. We know in the Framingham study, which was a Harvard study done, my gosh, 15 years ago, Dr. William Castelli, who was head of it, mentioned forming a 150 club. And what does that mean? He was amazed that nobody in this clinical trial, and it was a very large clinical trial, who had a total cholesterol less than 150 in this particular study, ended up having a heart attack. So that's important. But one of the most important lipids or cholesterols is the LDL cholesterol. It's important because it's what's used as a marker of how many particles we have that are potentially particles that can get into the artery wall and lead to heart attacks. Well, we know that it used to be thought that any LDL cholesterol less than 100 was optimal. And even prior to that, there were ranges of 130 used to be felt to be adequate. But then as we develop these clinical trials, we've come to realize that we were basically, our cut points were too high. And that what we know now, based on the most recent research, and I'm not going to go through all the studies because I could spend the entire evening talking about clinical trials that have shown that the lower we could get LDL cholesterol and the other potentially harmful types of cholesterol, the less likelihood that we will end up having a heart attack or a stroke or other types of vascular catastrophes. So there was a very interesting article that was written by Dr. James O'Keefe, friend and colleague of mine. And he basically, the article was entitled, "What is the optimal LDL cholesterol?" And the subtitle was, "The optimal LDL was between 50 and 70 milligrams per deciliter." And he really had a very interesting comment that they looked at hunter-gatherers that are still on this planet, people that hunt for their food and eat from the earth and eat from the sea. Hunter-gatherers on this planet, almost all of them have low LDL cholesterol levels, and their LDLs are, almost all of them have LDLs less than 70. And guess what? Very rare that you have a heart attack in one of these hunter-gatherers. Even more impressive is the fact that animals, such as animals in the wild, baboons, primates, all have LDL cholesterols between 50 and 70, and they don't develop heart attacks. So, as humans in the modern world today, we have LDL levels more than double that. The average LDL of people walking around is about 115, sometimes higher. And I think it's no wonder that heart attacks and strokes are the leading cause of death for men and women worldwide. We need to get our levels of these bad cholesterol particles that can cause heart attacks down to a point where they no longer can lead to heart attacks. So the answer to that question is, the standards are changing. They're changing every single year when we have our national meetings. And now we know that for everybody, it's optimal LDL cholesterol is less than 70. and the optimal LDL in a high-risk individual, somebody who's had heart attacks or somebody with a lot of risk factors for heart disease, really should be less than 55. And there's no harm in getting those levels very low. In fact, we have genetic mutations of individuals who are born with very low LDL cholesterol levels, down to single digits. And everybody, oh my gosh, how can you, don't you need cholesterol in your body? And how could it be that low? Well, the answer to that is real simple. We don't, because every cell in our body, as I mentioned earlier, is capable of manufacturing its own cholesterol for its physiological needs. And as a result, what we now understand is that lower is better. And the European Society of Cardiology, very interestingly, has come out with very stringent guidelines that indeed getting your LDL levels down below 55 is very important in people that are at high risk. Let's move on to a different topic, and that is the use of stents. So the next question is, when people have heart attacks, do they need stents? And the answer to that is yes. Stents are very important in people who are in the throes of a heart attack, because what happens in a heart attack is you get a rupture of the plaque, you then get a clot that shuts off blood supply, and the quicker you open that artery, the less damage, or what we call necrosis, cellular death, occurs beyond that area of blockage. So naturally, we want to open up that artery as quickly as we can and supply the heart with blood flow again. So in the setting of an acute situation, like an acute heart attack, or in the brain, an acute stroke, yes, it's, earlier is better. The quicker we can put in a stent or open up the artery, the better. However, and this is a big however, this doesn't necessarily mean that everybody and their cousin needs to have a stent put in if they have a blockage, but they're perfectly stable. Because now we're in an era of prevention. It's always better if we can stabilize a plaque and reduce that plaque with lifestyle and with medications as needed. And today we have very, very safe and effective new medications that have been developed through genetic engineering that can help to shrink these blockages or plaques down, and in some cases completely eradicate or eliminate them, which I say is a heck of a lot better to do that than to put somebody through a stent, put a stent in their body, or do bypass surgery. Those procedures all have potential risk. Now, for people that, again, are unstable, they're either in the throes of a heart attack, or they're having a lot of chest pain, and that's a different story. And I'm glad we have interventional cardiologists and cardiac surgeons. But what we know now is more and more people can be treated very effectively without having to get a stent put in them or having to have bypass surgery. We could pick up on that more at the end when we have a Q&A, but I want to move on. So let's see the next question. How many stents can a person have? Well, you can theoretically have an unlimited number of stents. That's, you reach a certain point where you wouldn't even have room in the arteries. We have three major arteries: the right coronary artery, the left anterior descending, and the circumflex, and we have a left main coronary artery. But it's certainly not my strategy, never has been, to see how many stents I could put in somebody. In fact, I could say just the reverse. I could say that I feel that my job as a preventive cardiologist is to prevent people from needing stents. And if I'm just willy-nilly putting stents in and I'm not Stents is like a Band-Aid. It doesn't cure the problem. The problem is too many of these particles, as I just mentioned. So unless you do something with lifestyle intervention or medications, as I discussed, to lower those levels of these lipoproteins that cause the problem, you can put in all the stents you want. You can do all the bypass surgery you want, but that patient will be back for more stents, more bypass surgery, and on and on and on. You need to fix the problem. If you had a broken pipe and it was causing your kitchen to get flooded and you had to mop up all the water every day, wouldn't it be a lot easier just to fix the pipe, fix the break in the pipe? But what we're doing sometimes in cardiology when we aren't looking at the root cause of the problem is we're not fixing the primary problem, which is too many of these what we call atherogenic or harmful particles that are getting into the artery wall and creating havoc. So I think there's going to be a paradigm shift coming very soon to cardiology and cardiovascular disease management, where we will prevent this problem from occurring rather than wait till it strikes like a rattlesnake and then trying to bail the patient out. Okay, let's move on to the next question. And what are the disadvantages of stents or bypass surgery? Well, the clear disadvantage is that anytime with stents, anytime you put metallic hardware into your body, you can have a reaction to that. And the procedure itself is not completely without risk. You could perforate, the heart. You can perforate an artery, cause a dissection. There's a whole number of things that can happen. Now we look at what's called the risk-benefit ratio. If somebody's in the throes of a heart attack, it's worth taking that risk. And today, in most major institutions, that risk is quite small, as we've gotten better and better of being able to put in stents in the acute patient with heart attacks, and now we have patients with strokes being treated. So that's important, but there is risk, and with bypass surgery, needless to say, there's risk as well. So I think if it's needed, these interventional procedures are life-saving. But like I mentioned earlier, if we could do a good job simply by treating the problem that's causing it, that's the best approach. Let's leave these interventional procedures for those people who fall through the cracks, who despite everything, they still may rupture a plaque and have an event. And then, fortunately, we have excellent cardiac surgeons and excellent interventional cardiologists that are there in the event somebody does have a heart attack or falls through the cracks. So let's move on to the next question. Can people have another heart attack once a stent is in place or if they've had bypass surgery? Well, from what I just said, the answer to that is yes, with an exclamation point. Because what we know is that putting in a stent or doing bypass surgery is sometimes necessary, as I mentioned, to restore blood flow in the heart, but it's not a fix or a cure of the underlying problem. The underlying problem are too many, again, of these harmful particles, these atherogenic particles that can get into the artery wall and create the problem in the first place. Now, we know how to do that. We know how to get rid of these particles. And that's where we should focus our attention. And the whole advantage, as I mentioned just earlier, of having cardiac surgeons being able to do bypass surgery or interventional cardiologists to do stents is for those individuals that present who are unstable, meaning that they're about to have a heart attack or they've had a heart attack and we have to do something acutely. But clearly, for once they're stabilized, the best approach is a prevention approach where we give people information on how to live a proper lifestyle, which includes nutrition that Dr. Tan is going to talk about, includes regular exercise, which is very important, includes certainly stress control, it includes good quality sleep, it includes maintaining a healthy set of teeth and gums so you prevent periodontitis, which leads to inflammation. It includes staying away from toxic air that has pollutants in it that causes inflammation in our body. It means staying away from cigarette smoking. And I could go on and on and on. All these things that I just mentioned are of critical importance. But I want everybody who is listening tonight to understand the first thing we always recommend is a healthy lifestyle, and with all these things that I just mentioned. But don't be fooled by the fact that you could do all those things and still have a heart attack and still have a stroke. And the reason for that is that there are also hereditary risk factors. So despite doing all the right things, if you inherit certain risk factors that give you, in some cases, a gain of function mutation or a loss of function mutation, then that can lead to a heart attack. And that's the very reason why, besides getting the right lifestyle, a proper lifestyle, it's very important that you get periodically from your physician a blood test that will measure those particles and see if you have too many of them. See if you have too much inflammation in your bloodstream. In some cases, we do imaging studies to see whether or not you have these atherosclerotic plaques. And if that's the case, then in addition to the lifestyle, we know now how to treat it with safe and effective medications. So I'm going to stop and pass the baton to my friend and colleague, Dr. Mary Tan, and let her talk about lifestyle and other things that are very, very important of maintaining good cardiovascular health. Dr. Tan.
Okay, thank you, Dr. Ozner. Okay, thanks everybody, and welcome to join us. So actually here we have a lot of questions people sent, and also people are still continuing submit some questions to us. So I'm going to concentrate here, answer a few questions here. So when I talk, maybe or include some of the questions that people submit, okay? So the first question I want to talk about, it's how do you know ahead of time you are likely to have a heart attack? So that question is very important. For the physicians, that's very important. It's what kind of people you're really going to pay attention. So for me and for Dr. Ozner, we have talked about that. Okay, the first group of the people we really need to pay attention is the people that have a family history of a heart attack and a stroke. For example, I have patients that have 2 generations, 3 generations, or 4 generations, if they track back, have a heart attack. So those are the people I will pay highly attention to them to say, okay, this is a very risky factor. Because a lot of times when you look at those people, some of them, they are not overweight. Okay, this is something later we can talk about that. So those are the first group of people I will pay attention to that. So the next is the people, they have had something. Let's see. they were not sure if it's important or not. For example, people have a very low heartbeat per minute. Let's see, if your heartbeat is lower than 50 per minute at the rest. So I think that needs to pay attention. And also people have, let's say, AFib, some cardiac arrhythmia, so something there. And those are the people I need to pay attention to that, as a physician, the clinical physician see the patient all the time. So those are the important things. So what kind of people you need to pay attention, including people yourself. And also earlier, so Dr. Ozner mentioned about the cholesterol level. So that's very important too. A lot of people say, oh, I'm not sure what my cholesterol is, or they show me the test of their cholesterol level. Let's see, the total cholesterol level, 260, and the LDL, 150, 160. So those are the risk factors. And of course, the others, let's see, have a high blood pressure, high cholesterol, or high sugar, smokers, and the drinkers, alcohol. So those are the people. Let's see. Those have a risk. So that's what they say. Okay, for me, so those are the people I need to pay attention. So simply, I just say that. Okay, now. And another question is, how do I know if I change my lifestyle and I know it's helping me? So let's see, simply for you to think, it's if your cholesterol level gets better, if you're overweight, your weight gets reduced, if your blood pressure level gets more stabilized or it goes lower. So all of that, those are the simple things you can see if you get improved. So that's an easy thing to think about and to check. Of course, the rest is the physicians. So we will see, if you're getting better, or you need to do something more to improve. And then later now, I'm going to talk more about the lifestyle and also the eating. So Alison, could you show those pictures? As last time, so we talk about that. So before I talk about that, I want to tell you something. Recently, I saw something. A top cardiologist, American cardiologist, went to China about 35 years ago. He was in Beijing and look at the Tiananmen Square. And he said, hi, Chinese people are healthy, because he saw everybody was riding the bikes and walking to work. The stream at the rivers of bicycles and walking, a few cars. 35 years later, he went to China again in the same hotel, and he looked. He said, Chinese people are sick now. The fact. So there was a doctor and a scientist in Cornell University wrote a book. 2000, this book was published in 2006. The author is Dr. Colin Campbell. So it was about 15 years ago. He used the data of the study because he researched different kind of diet all over the world. American diet, European diet, Asian diet, Chinese, all the diet. And the purpose he researched that is for cancer research. But his research extended to cardiac and to immunity and to many fields, many things. By the end, the shocking result is the heart attack rate for the male in China, the heart attack rate in China, the male, it was, that time was 17 times lower than the heart attack rate than the male in the United States, 17 times. But his data use the diet before 1980. 1980. So there's a big change from that time up to now. Give you the statistics now. China now has the highest rate of a death of a heart attack in the whole world. And also the highest rate of death of cancer in the world. So what happened there? What happened in China in the past 40 years? I tell you what happened in China. The whole country has changed. And then now, very sadly, almost 60% heart attack in China, it's the age between 30 to 50. And I have seen this here now in the United States too. So in the whole world. So first, let's look at this thing we talked last time about the biological clock. In China, when I grew up in China, I came to the United States in 1990. So I had the old, so-called old Chinese lifestyle. So that old Chinese lifestyle is based on traditional Chinese medicine. It's the culture. It's the traditional Chinese culture. I tell you what it is. Every morning, all the parks in China are open at 4 o'clock in the morning. So people are in the park doing Tai Chi and doing Qi Gong and walking and breathing. So people start going to the park at 4 o'clock to 7 o'clock. That's the time people are there doing that thing. And then go home, eat. So they eat between 7 o'clock to 8 o'clock, around that time, and then go to work. So the whole country is like that. And the lunch time, about 12 o'clock and 1 o'clock, everywhere was taking a small nap. And in the afternoon, so after the work, so people all going home to eat the dinner, and after dinner, the streets are full of people taking easy walks, walking there, easy walk. And in my city, so my city was a kind of big city. The population is more than Miami. I tell you, about 9 o'clock, you see the whole city start turning off the lights. About 9:30, the whole city was dark. If there's one window has the light on, that means maybe somebody is sick there, their family. Otherwise, the whole city was dark. And the Shanghai is even earlier. People in Shanghai, they all get up at 4. So the whole country has that biological clock. So people are having that kind of lifestyle, very regular, and follow the way of the nature, follow the universe, the energy flow of the universe. But now, China, all the city have all the lights on, and people are staying late, stay up late, not going to sleep. And the parks have only old people because they still follow the old way. How old? Those are the people, they're over 80, over 90, 100. I have relatives sent me the pictures a few months ago. They are 95. They're in the mountains in the morning. So old people are in the park, no young people. So the old people are still following the old way. So the young people all stay up late, including my relatives, my family. So they're doing it. So that's a big change of China. Okay, turn another one. So the daily schedule, the lifestyle has changed. So people are doing whatever they want. There was another big thing is the jobs. Now, many jobs are sedentary, sitting, no move. And China now has so many cars. There's so many cars in China now. The people are driving the cars. So you don't see many people walking the street. You don't see bicycles in China now. Okay, another thing, now talk about the food. So here, about the diet. So people ask me every single day, a patient talk to me, it is so confusing. There's so many kind, and I don't know what to follow and what to do. Of course, I have seen people, they change. 2 years ago, so they are vegan, and now they are keto. So it's a big change. So for me, every day I talk to people. So a few things are important. I said, the traditional Chinese diet. It's based on traditional Chinese medicine, I said, the TCM diet. So a few characteristics of TCM diet is regularity. Regular. What does it mean, regular? Eating time, regular. That's number one. Regular time of eating. Number two, the amount, the portion of each meal to be regular. So how much do you eat? You got to figure out how much you eat for breakfast, how much you eat for lunch, and how much you eat for dinner. So you have to regulate that. Because people ask them, how much? Oh, depends. One meal they skip, another meal eat a lot. So it's like no regularity. So that's second. And the third, it's the proportion. So proportion, this is so important. Proportion means, different kind of food group, how much is different group of food. And here, a lot confusing here. So usually I say, okay, the food, I tell people simply to think. So we group the food as vegetable, a group, grains, group, protein, a group, and the fruits. So we simply make the food as the 4 groups. So the groups, so we shouldn't, get rid of any of the food in those 4 groups. Shouldn't get really any of them. So that's number 1. So that's called the balanced. So now people are doing a lot elimination, eliminate one group of food and scared of some group of food. So that's not right. Let's see. People are scared of fruits. They say fruits has sugar. Okay, this fruit has sugar. It depends how much you eat. So let's see. This is the typical proportion of Chinese meal. We eat 3 meals a day and no snacks. So snack is something people ask me all the time about the snack. So I said, we grow up, no snack. No, we eat the whole lifetime like this. So breakfast, the grains are very important. So today I don't have time to talk about why it is important to have a grains for breakfast. It is important. So what kind of grains? Okay, for every, so oatmeal is a good group of grain. And for us, we eat the porridge, we eat the noodles, so grains. We use the grain as a major part of breakfast plus vegetables and the fruits. So all fruits has almost no protein. I tell you, we have been eating like that for thousands of years until now changed. What's the change? Change to the breakfast, eggs, milk. Eggs and the milk. Change to that. Eggs, milk, and the bread. Okay, they change to that way. So that's the change. And also, let's see the lunch and the dinner. So lunch and dinner will never eliminate any group of food. So let's see, I say percent. Percent, I tell people easily to do. Your food should be half of the food. It's all vegetables, at least 4 to 5 kind of vegetables. The color has to be dark green and the red, rainbow. Rainbow is a green, red, purple, orange, colorful vegetables. And another big part, we have a grain. People are scared of grains. I say, okay, if you're scared, then I tell people, okay, get some wild rice, buckwheat, and we eat the rice. Okay, yeah, people are scared. For us, I tell you, the traditional Chinese diet, our protein intake is only 5 to 10%. So here I say, okay, negotiation, we can have a 20%. That's the most. We cannot have more than 20% protein. After that, get some fruits, 1 apple, 1 banana, grapes, something, eat some fruits. And if you like soup, okay, make some soup, watery soup, not the creamy soup. No creamy soup, watery soup that cleans your body. So the dinner will be the same thing, same kind. So regular way of eating and different kind of vegetables and also the grain you can change too. I tell people, okay, you can change. You can have a rice, you can have a buckwheat, you can have some quinoa, and something you can change. The more kinds of food you eat, the better. And also the fruits also change. Don't stuck with only blueberry. No, they got to change. Seasonal fruits. Seasonal fruits. What is that? Winter time, the orange, the citrus. In the summer, watermelons, the other seasoning, either the peach, the pear, whatever, it's on season. Those are the best thing for you to eat because it has the high energy from the nature. Seasonal fruits. And also the American saying, the Western saying that the 1 apple a day keeps the doctor away, right? I love it. I eat the apple every single day. I think that's the best thing. It's the best addiction because sometimes people ask me, do you have any addiction, craving for something? I say, my craving, it's an apple, really. 1 apple. If I have 1 apple a day, I'm happy about it. Okay. So I think now I better stop from here. Of course, we can have a lot to talk, but there's something people ask, people have the question about that. Is it good to drink wine? So for me, it's no good because our culture, I tell you, all women don't drink. We don't drink any, we never drink a thing about anything with the alcohol. And the people say here, they said, okay, the red wine is from the skin of the grape. How about just to eat the grape? Okay, now I stop. So here we have people, give you some minutes. You can ask questions. Alison, let's see, some people submit something. So you can see another page, question number 14 to question number 21. So they are the questions that people submit. And there's some people still keep submitting the questions.
Yes.
So anybody, if you want to ask some questions, go ahead.
Yes, we have a question here. Online, actually. How often should we test cholesterol level?
Do you want me to comment? Well, if the question is how often should we test cholesterol levels, I think that depends entirely on the potential risk factors a patient has. So if somebody is really doing well, there's really, I would say that for most adults who are doing well and their cholesterol levels and their other blood levels of these atherogenic particles that I talked about are normal, then once a year should be adequate. On the other side of the coin, if somebody has risk factors, family history of heart disease, or they previously have had high cholesterol or other types of particles such as lipoprotein(a), triglycerides, etc., then you need to have the blood work done more frequently. But once a year is what I suggest. And it's not only to look at cholesterol levels, you look at kidney function, liver function, and a whole myriad of different things. And that should be orchestrated by your personal treating doctor. And I'll just quickly state that one of the best things everybody can do is have a discussion with your personal treating doctor to develop a prevention strategy before you get sick. And that's critical importance. Unfortunately, I don't think that happens in many cases, but you need to know not only how often to get the blood tests, depending on your risk, but also, there should be a discussion of lifestyle intervention and nutritional approaches like Dr. Tan was just talking about. And all of that becomes very, very important.
Perfect. Thank you for that. A question that I think is very important to address is question 18 here. Can a person get enough protein from just eating a lot of beans, nuts, grains, and vegetables? Or is some meat or fish needed a few times a week to get enough protein?
I think, okay, let me talk about that. So here, there's a thing, every time I mention about what do you eat, almost everybody answered the question is protein. So I eat the protein. I eat a lot of protein. So it's how much protein do we need, our body? And also where, our body get the protein. So this is a confusing thing. It's like, is that the more protein we eat, the more our body get it? It's not really true, because almost many kinds of food that contains protein. So for example, let's see, broccoli, mushrooms, string beans, they all have a protein. And it's not just the pure protein intake that makes you protein. Actually, in biology, liver is the organ that can really make the amino acid. It's not the protein we only get from what we eat. And actually, the very high protein is very dangerous, like the keto diet. Let's see, the animal proteins. The animal protein contains a lot cholesterol. And also another thing is, it's the cholesterol combined with the calcium particles in the blood. So they get together and make the plaques or the embolism. So that causes the cardiovascular problems. So about the calcium in the bloodstream, what that happens so far, so a lot of medical theories said that we don't know. We don't know what happened so far. There's nothing proof, what happened, why the calcium gathered so much in the bloodstream. So this is theory, okay? I personally, let's see, not sure, okay? Everything has to be, scientifically or in the lab to be proven. But there's a theory, I think it might make sense. It says the waste of the protein, it's the nitrogen, so it has the high H. So the nitrogen. So because the nitrogen in chemistry is acidic, so the blood become acidic, the pH gets lower, so the body automatically take the calcium out of the bones into the bloodstream and to harmonize the pH. So this is the theory about it. And let's see, so far we say, okay, we don't know if this theory is correct or not, but there is some facts there that people, if they are vegetarians, so they eat, plant-based diet, definitely they have much lower rate of cardiac vascular problems. So that's the fact. And also, as I mentioned earlier about Chinese diet, the classical, traditional Chinese way of eating, and definitely as a cardiologist in China, before I came to the United States, I saw that, I knew it. people, they have a heart attack, other people, okay, the whole country didn't have much protein to eat anyway, but the heart attack happened to people, they drink alcohol, they smoke, and they eat more meat than the people in the same family. So that is something I say, okay, something about facts, clinical facts, maybe not the lab science. So if I'm wrong, Dr. Ozner, you can correct it or you can have your opinion.
No, I agree. I think a plant-based diet, I'm really certainly feel is a very, very healthy diet. The only thing that I, would say is that occasionally having omega-3 rich fish is important to provide omega-3 levels such as EPA and DHA is what I've always recommended, and it's based on clinical studies that have shown that when you measure omega-3 levels, if you're deficient in EPA and DHA, you have a higher risk of sudden cardiac death. And we don't have enough time to go through all those studies, but by and large, and I have been a proponent of a Mediterranean style diet, but I will tell you that what is at its heart, a Mediterranean diet is exactly what Dr. Tan is talking about. It's a plant-based diet. The only difference is that we, include having cold water fish, to provide us with omega-3, and but I think, and I agree with Dr. Tan that unfortunately the keto diet has become very popular, and I would caution everybody to think twice about the keto diet, because recent clinical studies have come out to show that there are some harmful effects of staying on a ketogenic diet. These were recent clinical studies, in fact. And, I think that people who go on these ketogenic diets want to lose a lot of weight quickly, and it just doesn't work that way. What they lose, anybody who loses a lot of weight over a period of 1 or 2 weeks, what they're usually doing, and especially a ketogenic diet, is losing water weight through ketosis and solvent drag. So it's like taking a diuretic and losing weight. The thing is that once the kidneys then sense that you're dehydrated, and they're going to, start holding on to water and fluids, and then people gain the weight right back. And it's the yo-yo effect of losing weight, gaining weight. So I don't think the ketogenic diets are very, very good, but I certainly am an advocate of a plant-based diet or a Mediterranean style diet.
So it's 9 o'clock. I think we have maybe a few more minutes for one more question. I was thinking, Dr. Tan was talking about calcium, and we have a question here, number 19. Thinking about women aging who are supplementing their bodies with calcium. I'm wondering, Dr. Ozner, if calcium supplements are bad for the arteries, and can they contribute to calcification of the arteries?
Well, that's a good question, and it certainly, we can't answer that definitively because I can tell you that what calcified plaques in the artery generally are felt to reflect the small rupture or leakage of a plaque, and then it gets calcified. And I don't think we have the data to say that taking calcium supplements will definitely increase that from happening. And with calcium supplements, I mean, they're really, people can be deficient in calcium, and people can have a calcium level that's too high. And that's why, again, getting blood tests, getting a serum calcium level is important, because then if somebody has a calcium level that's too low or too high, there's strategies to be able to evaluate that and treat that. And I think that, and it's an important question, because, certainly men and women, but especially women with osteoporosis, for instance, need to have the proper amount of vitamin D and calcium so they don't develop significant osteopenia and osteoporosis that could lead to fractures, such as hip fracture and fractures elsewhere. That's a whole other topic, but I think it's certainly a good question. And my answer would be that you need to check your calcium levels, whether you're taking supplements or not. And if you're too high or too low, you should have a discussion with your personal treating physician.
Yeah. And for Dr. Khan, on that same question, can leafy greens and vegetables and even low-fat yogurt or low-fat milk can be a good source of calcium?
Yeah, now we're talking about calcium.
Yeah, just a little bit.
Right.
Yeah.
So the calcium really we can get that from the natural food. So it is the very interesting question about the calcium. And also, let's see, if you test the blood, either the calcium in the blood, it cannot really tell you much about if those calcium particles get into the blood, either the vessels combined with the cholesterol, or it's just a high level of calcium, because the high level of calcium in the blood actually is the problem of the parathyroidism. So it's a problem of the parathyroid. So that's something, some condition you need to treat. But the lower level of the calcium blood, so it's not, because now in the medical field, they judge if you need to be treated or not treated. It's by to the X-ray to check you the bone density. So I also have that question, that topic. It's difficult. It's not difficult, actually, different opinions. Let's see it that way. So different body type. And the bones, actually, it's not the strength of the bones. It's not about the thickness of the calcium of the bones, because the bone has different structure. So inside of the bones, the bone marrow, and also very important that there is cartilage part of the bones. It's a soft tissue. For me, that is the important thing, because that makes the bone more flexible and easier to heal. Because let's see the facts. Like all body type, small body type, petite. If we go to see the doctor will say, okay, you have the thin bones, you're going to have a fracture. No, because our bones are more flexible and it doesn't break easily. And also, if really have the fracture, it heals, because it's not just the density of the calcium of the bones. So that can be another big topic about the bones. Actually, in the China study, that book, so the search of different kind of diet. So in the conclusion, the countries, so they have a high, the food that rich in calcium. Let's see, dairy or protein, actually they have more bone problems, osteoporosis, than the people that have the low intake of this so-called calcium-rich food.
Okay.
And there's another question people ask. Say, my mother or somebody, okay, all the patients themselves ask me, said, I've been on the medication for every kind of medication to lower my blood pressure, to lower my cholesterol, and thin my blood, but I still get the heart attack. I still get the stroke. Okay, here, this is important. This is the purpose Dr. Ozner and I are here to talk. The root problem is really correct. Your lifestyle, your eating habit, to make sure you don't have those things in your blood. You don't need to take medication because you eat, you take the medication, but the major problem, the root problem, is not corrected. And then you still can get into the trouble. And I have patients, let's see, they have a heart attack, they get a stroke, they have multiple heart attacks. If they don't change, it's very dangerous because you can have 1 or 2 or 3 or 5 heart attacks. I have some people have a 10 stents, have multiple heart attacks. Okay, that's why prevention is very, very important.
Okay. My computer died.
Okay.
So I hope you all can hear me. We had a few other questions about exercise and types of exercise to maintain a healthy lifestyle. I'm not sure if you'd like to address that now or considering is
Okay, maybe just a few minutes earlier. So
Yeah.
Dr. Ozner says regular exercise. That's important. Regular. Let's put that way, regular. Regular means daily. Do something. I prefer you walk 20 minutes a day. Then all of a sudden you do 2 hours of weightlifting or running at the stop for a week, at the stop for a month, and all of a sudden you go to the gym to do the strenuous exercise. Actually, that's dangerous, very dangerous. And also, what type of exercise depends on each individual. Let's see, if your age, different age, choose different type of exercise. I have a lot of patients come here. They're over 70, and all of the sudden, they determine go to the gym, weightlifting, and in a week, so they have a herniation, cervical herniation, lumbar herniation, so much pain, they cannot do anything anymore. So it depends, it's better you build up the habit to do it every day, at least a few times a week, 5 times a week, do 20 minutes to move. And also people, if they have a job sitting all the time, you better get up to walk or stretch to do something. Dr. Ozner.
Yeah, no, I agree. In fact, I think the biggest problem we have in the United States and the developed world is it has to do with sitting time, that people sit without moving for extended periods of time, and that's not healthy. And I like to tell people, when I talk to them, I like to mention the word physical activity rather than exercise, because we were born to be physically active. And I've always told my patients that if you have a desk job and you're sitting, set an alarm so that in every hour, you could, after 45, 50 minutes, you could get up and just walk in place, walk up and down a staircase to get some kind of physical activity. But that is not the case for many Americans, and they are sedentary. And guess what they do when they get home? They flop down, they eat a big dinner, and they watch TV all night. So it's not a healthy lifestyle. And I think exercise is just as important as nutrition. And it's really physical activity. We should eat right. We should be physically active. We should avoid stress, and we should maintain a normal blood pressure. And I saw one of the questions had to do with air pollution. We certainly should avoid air pollution. And the reason for that is air pollution leads to increased inflammation and oxidative stress and free radicals that increase your risk of heart disease and cancer. So all of these things that we talked about tonight are important. And, I think that, hopefully we could carry on the discussion and future webinars, and, because I think we're really just scratching the surface, but I think this is important information for people to understand and be able to incorporate into their lives.
Yes, agreed.
You can stop it.
Okay, so I think we are ready to wrap up here. Thank you so much, everyone, for joining us today. Thank you, Dr. Ozner and Dr. Tan, for taking the time to take us through the basics and through the nitty-gritty of heart attacks, really. As we can see, we have a lot more topics that we could cover under cardiac health. If you have any questions in the coming weeks as you review this information and the previous webinars, reach out to us. You can email Dr. Tan at drmarytan@yahoo.com, and we'll collect the questions, and we'll assess all the questions and maybe put another webinar together to answer any upcoming doubts about other topics within cardiac health that we haven't had a chance to discuss today. Thank you again, everyone, for joining. I hope you have a good night.
Thank you.
Thank you.
Thank you, Dr. Ozner. Thank you, everybody.
Thank you, Dr.
Thank you. Thank you.